So this is very exciting for us. We haven't done this before in terms of inviting people from the public and not just scientists and psychologists and whatnot to come and learn about concussions. We thought we would try to practice good KT, knowledge transfer, and inform everybody about where we are in terms of our research on concussions and try to bring everybody up to speed. We think that it is important for parents, athletes, teachers, coaches, trainers, also physicians, to learn about concussion. We have a number of people here from our advisory board, so thank you for coming. We started in the concussion field here about 10 years ago in earnest to try to provide some answers to questions about, why did this person get a concussion and not another, and why does somebody recover and another doesn't. And so we have been able to get a few answers. Unfortunately, there are still more unanswered questions out there that we're working on, but research is quite remarkable in what it can do. In fact, research is why we created this, to try to get these answers that are needed to help families through this. And so this event is really dedicated to families who often bear the burden of these injuries. And many of you already know that concussions have been relatively neglected in many aspects in terms of recognition, that they weren't recognized as readily as they should have been in many cases, and they really did lack for methods of management. And we are trying to make a difference. And the title of we've given this session various titles. We've said it's in association with our annual Concussion Research Symposium, which is actually going to be held tomorrow. So if any of you are doing nothing tomorrow, from 8 to 5, we will be in this room trying to get some more answers to concussion. And we invite some incredible speakers, and one of them is going to speak to you tonight, one of our honorary guest speakers who came at great effort to get here on time, quite amazing. The symposium this afternoon started at 2:30, and I think your plane landed about 1:30. So good of you to rush over here. So one of the titles that we gave to tonight was Concussions Through the Eyes of Concussion Sufferers and Their Families. And we said it is dedicated to the families. We have many families here tonight, and hopefully you'll all gain something from being here. The research in concussion is very costly. When I was preparing these remarks, I was just running through my mind how much we actually have spent in trying to get some answers. And in fact, none of us who actually do the research here are remunerated for it. So our efforts here are essentially on the basis of what we earn in our clinical practices by and large. And in fact, grants have been very difficult to come by. The standard granting agencies have are very good about funding cancer and heart disease, but when it comes to concussion, there's very little left over. And so we're grateful to the foundation of our hospital for filling in the gaps. And in fact, we have, I think of it as burning through our money. We've actually spent about $5 million on concussion research since we started, and very little of that has been through standard granting agencies like government-supported agencies, and most has been through individual donations from families and corporations. The washrooms, I'm asked to remind you, are just in that direction. So when biology calls, it's that away. We will want you to ask questions at the end of this. I think there's paper on your seats or nearby, that's what I was told, for you to write down your questions, and they'll be collected. And we'll try to answer as many of them as possible. So that is really my opening remarks, and I would like to go on and introduce our first speaker, who is going to be Dr. Carmela Tartaglia. Carmela is an associate professor at the University of Toronto in neurology. Her focus is on neurodegenerative diseases. She is also a scientist at our TANS Center here in the hospital in neurodegenerative disease. She has played a major role in our concussion research right from the start. She said, "I'll do it." That type of volunteer is fantastic. And she actually has become Canada's first chair in concussion research. We're very proud of that we have actually a university chair in concussion research, and Carmela is the first holder of that chair. So she's going to talk to us about update on science of concussion. Thank you.
Thank you. Thank you all for being here. So I'm going to talk to you a little bit about concussion and just try to go over some of maybe the facts and fictions and a little bit of what's happening in the research world. So basically, we'll start with defining concussion, go over the symptoms, and a little bit on treatments. So I don't think I need to tell anybody here that concussions are very, very common. And, you know, we used to focus on sports, but, I mean, people can get concussions from any mechanism, and now it's been recognized that, you know, even blast injury is a problem. And I think it's really important to think that the symptoms that you're getting after a concussion really come from a brain injury, though we can't detect it to date. But really, when when you get this headache, when you have this mental fogginess or dizziness, they really come from changes in the brain. It's usually not life-threatening, and the MRIs are normal by definition. There are a few. This is a sequence that's more sensitive to blood, and so people are investigating this, and sometimes we find blood, sometimes we don't. We actually don't know what it means because a lot of the definitions were created before people got routine imaging. We have to say that although we initially got very excited because some of our participants with post-concussion syndrome had blood, we have a control group, and there's a number of them that did too. So we don't know what it means. So right now, there's no there's no diagnostic tests. You might have heard recently that people were promoting a new discovery, a test for concussion that basically was going to measure these two proteins that were in your blood. That test, at best, will be a test for moderate to severe brain injury, but it will not be a test that can detect concussion, nor can it rule out concussion. But it can rule in that there's something more severe than a concussion. Oops. So concussions are usually mild. People usually recover, and there's a worry about this cumulative effect from repetitive injury. And like I said, most people get better. The symptoms are very variable. There are cognitive symptoms, personality symptoms, or physical symptoms. So all kinds of things can come about after a person has concussion. And so you can tell that these symptoms also belong to, you can have a headache and it doesn't need to be related to concussion. You can have mood issues and they don't need to be related to concussion. These are symptoms that come from a change in the brain. So what causes a concussion? Really, it's a strong hit to the head or the body. And I think that's really important because until recently, we thought you had to hit your head. But now we have a lot of people who, they've never had any injury to the head, but the hit to the body has really been, energy translated to the brain and it resulted in concussive symptoms. So I've already gone through that you can't, oops, it's really sensitive. That you can't really diagnose a concussion with regular imaging. What are the risk factors? Well, obviously playing high contact sports, being younger and being older are both actually risk factors. Women seem to be at higher risk of suffering a concussion when they get a hit to the head. And previous concussions seem to put you at risk, and it seems to take less and less to get a concussion once you've been concussed. And there's probably a genetic component. We do sometimes see that it runs in families, but we don't know what that is. There's actually no equipment to prevent concussions, although helmets are really good for preventing moderate to severe injury, which you really don't want. So some of the myths that people have been confronted with respect to concussion is you have to lose consciousness. That's not true. You need the direct blow to the head. That also is not true. You should wake people up every 20 minutes after concussion. That is not true. Children do not recover as quick the same rate as adults. There are long-term effects of concussion, but we don't know really what they are, and they don't occur in everybody. And this idea that a concussion is not a brain injury, I think, really needs to be, dismissed. Like I said, women seem to be at higher risk. And, this idea that an athlete is the best person to decide if you got a concussion or not is actually really fallible. I mean, to think that judgment does not live in the brain and that a person who's got dizziness and memory problems is going to be able to say that, yeah, I've been hit hard enough and I should be out of this game is really a disservice to, or a misunderstanding of what the brain does. Oops. Okay, maybe this is the way. Okay. So in terms of treatment, I think it's important that a person who gets concussed seek medical treatment. They should rest, but there is, we ask people to rest for 24 to 48 hours, really, and it's not in a dark room. It just means, get yourself out of harm's way. Don't go play a contact sport if that's how you got concussed. Try to, take it easy. We give, pain medication. Low impact exercise is actually prescribed after, the first few days. And we usually want people to see a doctor prior to resuming full activity, especially if they're children. But there are no established treatments for concussion. We treat the symptoms based on the evidence in the primary area. So if you come in with a headache, we don't have concussion headache specific treatments. We don't have concussion depression specific treatments. We borrow from the areas that, psychiatry or headache medicine or sleep medicine. This idea of rest after concussion is still kind of popular. I think it's dying down, and it really actually, if you look at the literature, there was very poor evidence for it. It kind of made sense when people were getting concussions from sports, because obviously the worst possible thing would be to suffer a second concussion while you're still healing from the first one. And so we do want people out of harm's way, but there is really no significant evidence for rest. What about post-concussion syndrome? Well, this is even more heterogeneous than concussion itself. There's 10 to 58% of people who seem to not recover within that, that quick time span. And, the actual numbers or the incidence is very difficult to really know, because there's been different definitions used. And these are two of the more classic definitions. There's currently the new ones from Berlin that basically say you have persistent symptoms for 10 to 14 days in adults or over 4 weeks in children, and these are called persistent symptoms. Is it the same? We don't know. So risk factors for post-concussion syndrome, like I said, age, women, history of prior concussions, amnesia, so not remembering the concussion. So, asking people how many concussions they have, this is a really big problem, because sometimes you actually forget the worst concussions. Confusions, memory problems, greater number of symptoms, mood seems to be a risk factor. In terms of treatments, I've gone through that. You basically treat the symptoms that people have, whether there be headaches, depression. We prescribe aerobic exercise, social activity, psychotherapy if they need it. The ONF has put out recently standards for care of persistent symptoms, and I urge you guys to look at them. There is recently a lot of concern about the long-term risks. I think in the football players, people have come out worried about this chronic traumatic encephalopathy, this delayed neurodegeneration that can come about after multiple concussions. It was first described in the boxers, actually, but now has been shown in other sports as well as military, and people are worried in other cases of repeated concussion. It's a progressive neurodegenerative process, and it's supposed to evolve slowly over decades, triggered by repetitive mild traumatic brain injury. And the symptoms that go with this are, probably notice symptoms that go with other neurodegenerative diseases, whether they're psychiatric, whether they're cognitive, there's dementia. But right now we can't detect this in vivo. And, the symptoms actually overlap a lot of the other neurodegenerative diseases. So we can't tell when somebody comes into our clinics and they're 70 years old and they were a former professional hockey player or boxer or football player, and tell us, well, I have had multiple concussions, and they're saying their memory is not very good and their attention and they're more irritable. Those are the symptoms of other diseases too. So it's very tough to be able to tell somebody, well, this is what you have. This is a pathology that's been described in this chronic traumatic encephalopathy, but we've shown here, our neuropathologist Lily Hazrati shown that, only half the players, and now she's got a bigger group and showing that only 30% are really showing this pathology. So it's not everybody that gets it. And so this was a big study that was done on almost 5,000 brains, and they found it in 21 of 66 former players. It's recently been shown in soccer also. So we don't know what the clinical signature is of CTE. Like I said, people present with symptoms that could be ascribed to Alzheimer's disease or Parkinson's disease. And so we really are trying to find ways, and we're working at the Canadian Concussion Centre to find ways to detect this pathology in the person while they're sitting in front of you, with the hope of maybe intervening at an early stage. We do a lot of imaging. One of the new imaging modalities we're using is PET ligand. So this tau that builds up in the brain, we're trying to detect it if we can. There's a ligand that's been, a tag that's been developed for Alzheimer's disease, so we're testing it in former athletes, professional athletes. And we do see that there are some people who look like they're positive, they got more red and yellow in the brain, and some people who look negative, and we're trying to understand, does this mean anything for the players? The reason we're doing this is because we know that in the other neurodegenerative diseases like Alzheimer's disease, Lewy body disease, you got 20 to 30 years where you're accumulating pathology and you're completely normal and you're fine. So this would be a window of opportunity for us to be able to intervene at that time and maybe stop the pathology at an early stage. So to summarize, concussions are the result of brain trauma, and the symptoms are very varied. We don't have any diagnostic markers to date. High contact sports are a risk factor, but you can get concussions from many different activities. So they're not curable, but we can help the symptoms. And the post-concussion syndrome that results from concussion is poorly understood. We really do need a better biomarker for this also. And right now, I think, it's important to think that, if you've had a concussion and you still have persistent symptoms, that you just get the help for the symptoms that you have. So with that, I'd like to acknowledge that I'm part of a big group of people who that I work with. Thank you.